through which he has mentored thousands of students so far and guided them through successful careers. His vision has brought many industrial partnerships like ISCR, SEDM, and ARCP. And I would like you all to know these partnerships are very, very unique to Clinosol at the moment. Not any other clinical research training institute has them. Moving on to Ms. Uma Priya, she is our director, co-founder. She has an MSc and MBA from JNTU and an experience of 20 years. She has worked with various organizations, starting as a junior associate in medical documentation. She advanced to becoming a quality head and later a project lead at Dimension Infotech. She co-founded Clinosol with her extensive knowledge and experience and has been pivotal in shaping Clinosol into a premier training institute. Our students reach out to Uma for her exceptional knowledge and insight in CDM, AI, and clinical research. We have Almaz with us here. Almaz Syed is our Director, Business Development and Training. She's also a senior consultant for the PV and all other hands-on trainings that we do. She has over an industry experience of 20 years, 10 of which she has spent in hardcore training. She has held various leadership roles in PV across the industry and has over 300 sessions to her credit. She has been associated with TCS, CTS, and Wipro in the past, and all this in much senior position. I'm part of Clinosol as a training and development lead. I bring with me about 13 years of experience, a core of which has been in clinical research monitoring. I'm passionate about communications and I look into all your job placements. I look into your mock interviews. So that is about me. I hold a MSc in life sciences and a diploma in clinical research. So I'll pass on the lead to Almas. She will take you through the rest of the session from here. Almas?
Yeah, thank you so much, Lavanya. Can you please hold your... Okay, let me share my screen then. Okay, please confirm once my screen is visible.
It is.
Okay. All right. So with that, students, this is a very important piece of information that we wanted to share with all of you. Okay. So we started Clinosol and we actually conducted a SWOT analysis or a gap analysis. This was to understand what is the academia and industry gap. Okay. And with the analysis, we found that there is an industry disconnect, which simply means that whatever syllabus, curriculum, or the way trainings or sessions or teachings were done in colleges or in academy, this was not aligned with the industry requirement, right? This was actually not in line or not in expectation with what the employers need. To give you a few examples, there were we found that the curriculum was outdated. Okay, it was not aligned with the current industry trends. Now, I hope all of you understand that when we talk about clinical research, this is a highly regulated domain, which means that there are lots of changes in the regulatory requirements that comes in. Okay, so it's important that each one of us as a clinical research professional, we read, understand, and implement all these regulations in a very timely manner. So this is something which was a big gap. Okay, coming to the knowledge gap, with the syllabus, with the curriculum which was used for training the students, there was lack of interdisciplinary knowledge and integrated learning. Now, as per the industry expectation, it is important that all the associates or the employees, they are aware about what are the different connections, how do you link with CR, PV, CDM, clinical research, medical writing. These are different functions. However, there is some kind of commonality when you interact, when you become an employee or as an associate. There are lots of processes which are interconnected, right? So it's important for you to understand how and what kind of synergies lie. Okay, integrated learning would mean that along with your technical expertise, your domain knowledge, there are lots of other, technological advancements, clinical data science, AI, ML, etc. Your computer, your creative learnings or innovations. All these things are also important, which is actually missing from the academia. Also, there are limited practical exposure and hands-on training. Now, when we talk about any specific domain in clinical research, right? Even if you talk about clinical research, there are different or complicated documents, like you have your protocol, your CRF, your IB, right? Coming to PV, you need to understand about how an assay reporting happens, right? Lots of things. So these kind of exposure, or for the students, it becomes very difficult to understand in the college or in the campus environment that how this looks like or how does it work, right? So these were some practical, exposure on hands-on related training, which was clearly missing from the knowledge segment. Skill deficiency. Now, apart from your technical skill, knowledge, lots of requirement, or, you need to share communication with your internal and external stakeholder. Okay, soft skills or interpersonal skill, because you will be interacting with team members, right? And then professional development. So you join at an executive level. What are the different kind of skill that you should be looking for your further growth or development? Lack of teamwork and exposure to problem solving skills. So team, because you are working with a different function, there are lots of interaction that you do within your team. At an executive level, you need to interact with your project manager, your colleagues, your peer, right? And also in day to day activity, with the role that you take up, there would be lots of issues, challenges, which you have to handle. So how do you take care of these problem? This was missing, or this has not actually been addressed in the academic setup. So here at Clinosol, after we performed this gap analysis, we thought of addressing these problems. And these are few examples how we have taken up and we have addressed these problems. So the first one was with the curriculum, right, and the hands-on learning. So the curriculum needs to be updated. Like I mentioned earlier, that the regulatory requirement keeps changing. So it is important for all of us that we understand what is changing and how does it impact, the way we are performing our role. Hands-on learning, or, the hands-on training. So there are different apps or database that exists, in which you start coding, you do your PV exercises, you do lots of data cleaning activity. So these needs to be understood, and you have an exposure only after you start practicing this in the live environment, right? So here with Clinosol, recently we just conducted last week a Medra hands-on training, and this was as per the latest version of Medra, which was released in March, right? So that's the level of update that we are providing or exposing our students to. Next is the industry associations and networking. So I'm like proud to mention that Clinosol is associated with lots of organizations or industries like SCDM, ACRP, ACDM, ISCR, right? With this, it helps us to understand what's happening in the industry. We are also able to share these knowledge, connects, updates, and take our students to these kind of industries or forums, which helps them to interact with different industry partners. Okay, interdisciplinary learning through combinational courses. So with Clinosol, we are offering you different kinds of courses along with clinical research, PV, CDM, medical writing, okay, regulatory affairs, and this combined with your clinical data science. So we are not conducting any or not sharing any standalone courses. There are different combinations which helps you to understand end-to-end clinical research, right? So even if you start interacting with a person or an executive in a different team or function, you know exactly what's coming up and what's the request that you need to look into. Additional skill development. So apart from your technical knowledge or the skills that you need, your domain knowledge that you need to perform your role, you also need to understand about how the writing happens, what's happening. So we are assisting in blog writing, publication, presentations. So it becomes very easy for the students to understand whenever they are appearing for an interview. So this additional skill helps them also within the organization, whenever they have to take up a higher role, like becoming a team lead, making a deck presentation for strategic meet. All these things become very important. Alumni meet. We have a periodic alumni meet where we call our ex-students. They come and address with the group team. They share about their experiences, and there are lots of events that we conduct. So we believe in staying in touch with all our students, and it's a continuous support. So it's a long time relationship with all our students that we believe in maintaining. Next is about the soft skills development. So taking up any role, there is a requirement for you to work on your verbal or written communication. Lots of understanding, lots of practice should go in even when you're appearing for your interview, right? So how do you build your profile on LinkedIn? How you start connecting? How you build your social networking, right? How you build up your resume, mock interview. So these are, some kind of sessions that we keep conducting continuously, which helps our students, in grooming and gaining that confidence for, stepping out the campus or, entering into a corporate. Also, we are providing lots of mentorship and internship programs. So we are like 4 to 5 trainers a year, and we are taking care of students in a group where we guide them, we mentor them. There are also official internship programs which are provided, after which an experience letter is also shared with the students. So this is about how Clinosol is addressing the gap between academia and industry. I think that's it from my side. I would like to hand over to my colleague, Mujib here, to take it up further from here.
Okay, thank you, Ilmaz. Thank you. So I hope my voice is audible and visible.
Yes, Mujib, you are visible and you're audible as well. Yep.
Yeah, thank you. So I'll not take much time. So quickly, I'll complete my part of presentation. Most difficult part. Everyone would like to know about what is there for me for Clinosol. So when I started, I think Clinosol down the line, I think 5 years back. So I thought only training is needed for the student and youngsters, and more required is knowledge, what is have to be given to the students. But later on, I have understood that more than training, more than teaching, more than subject, there are other things which has to be understood, which has to be given for the students. So one of the most important, interesting point which students wanted is placements. So everyone will come to Clinosol for only one reason, that is placements. What best you can give for the placement. But we try to understand how we can get more placements, how we can give in this competitive industry, how we can give more jobs, opportunities in terms of clinical research, CDM and pharmacovigilance medical writing. We understood there are multiple factors which affects the placements. Either it is the learnings, either it is the communication skills, either it is complementary courses, or either it is about understanding analytics, or either it is hands-on experience, either it is conferences or industry expert sessions or alumni sessions or assignments, assessments. So there were many factors which were being assessing for the placements. So we came up with a wonderful strategy that how best we can give the training. So now Clinosol is not just a training institute. Clinosol is more professional organization where we look at 360 degrees development of the students. So what exactly is Clinosol, and how Clinosol provides the training for the students, and what are the other factors which can impact your careers? So these are the factors which makes impacts. What sets Clinosol apart? So what is the difference when you see the all organization which provides the training in the same domain or clinical research domain? What makes Clinosol as a different when it is compared with the other organizations is something which we have to understand. The first point which we have to understand is what is the fee structures of comparison between Clinosol and other organizations. So that I'll give a comparison that what fee structures, because everyone is waiting here to understand only one thing. What is the course fees and what is the cost for the fees of this course? We will speak about a lot of things about what best you can do in the courses and ABC, all those things. So what is the fee structure? That's the first point. The second point, when you want to choose Clinosol, you just have to understand that what are the other syllabus or what are the content of the courses which are being provided. Because everyone will come up and say that, okay, I'll give the course for 2000. But exactly what syllabus, what course content, what is the standards they are maintaining, international standards or GCPs or regulations, or what exactly is their course content? We are going to discuss about it. The third point, very interesting, LMS access. So nearly 200 to 250 videos, recorded videos are already available for the student access. How they can understand the videos and come back to class and listen to live classes one more time. So there is a process here which is called as flip side learning, where students are being given access to the videos. They listen to the videos, they understand the class, and then they come back to class one more time. Live classes will be there. And there they will ask more questions to understand about how interview-based questions are being asked, and what are the point in times of the assessments, how they will put the questions or how they will ask for interview-based questions. During interviews, they can discuss in the live classes. And the third one or fourth one, most important thing is there might be people who might come and say that, okay, we are the trainers. But how much experience they pull up, how many conferences they have given, how many workshops they have conducted, what is the industry conferences or what is the industry experience they are coming up, that experience trainers. So they might come and say that, okay, we have 2 years of experience. So what's wrong in having 2 years of experience? Because they will not be in a position to understand the capabilities and application of guidelines or regulations or SOPs or protocols. How this experienced trainer matters. What experienced trainers we have in Clinosol? That's one more thing. And the next one, fifth point, is about learning materials. What are the learning materials? I have already said that we'll give LMS access, which is 250 videos will be given. But apart from that, soft copy or hard copy materials are being given. What materials are being given to Clinosol students for learning? So that's one more factor we are giving. And one of the interesting factor everyone wants to know is that's about your placements. So what placements are being supported? How many placements are being there? So are these placements are really genuine or not? How we are going to point it the placements. So because I can come and say that, okay, we have 200 placements, but whether the students have really got placed, which company, which date they are joining, what is the position name they are joining, all those details, how are we going to show you about the placements also, we'll be able to show it. And one more thing, apart from regular classes, every weekend there will be an industry expert and alumni sessions. Every weekend, one industry expert like directors or vice presidents will be coming and taking sessions for our students to make sure that how their industries are working and what is the expectation from industry and skill sets which is required for particular positions and what is the growth level of that particular position. And one of the factor to decide whether Clinosol is good or not is about awards. How many back-to-back awards? Might be 1 or 2 awards. But now currently we have got, I think, back-to-back 9 awards we have got. So we'll be discussing about that factor as well as, which is called as awards. One more interesting factor is what are the different courses and what are the combinations. So I have already said that there are multiple courses, multiple job opportunities. One is clinical research, CDM, pharmacovigilance, medical writing, regulatory affair, HOR, or SAS, or medical writing. So all these course combination, what are the courses which we have? What are the combinations we give? And what are the individual courses we give? So we'll be discussing about that. And one of the factor, very interesting factor, is something which is called as assessment. So assessment is something which is more important needed for us to understand the capabilities of the students, to make sure that how this students are taking the understanding about the knowledge of the courses. So that's one more assessments we were discussing about how we can do it, the assessments, what assessments can be given. And there is one more thing which we understand that is about your writing skills, which is blogs, presentations, and articles. What are the students doing the blogs? How many blogs they are writing? How many articles they are writing? And how many presentations they are giving? And what is the capabilities, the skill development of writing skills they are doing? So Clinosol is just not a training institute. It's a big professional organization where students come up with more assessments, assignment, blogs, articles, presentations, webinars, workshop, awards, IES, and alumni sessions, and also complementary courses, assignments, and also about how the ecosystem works. So altogether, Clinosol have a different strategies to give trainings. So regularly we have online classes and offline classes, and you will have a LMS access. Every weekend you will have a industry expert sessions and alumni sessions. Every month you will have at least 3 industry experts and also 1 international conference you have to attend, 1 blog, 1 article, 1 presentation you have to submit. At least you have to write 3 assessment for each course combinations, and at least you have to submit 4 assignments, and you have to attend more than 90% of attendance of the classes. So altogether, it shows the impact that how students can get placed. So that's where we are putting pressure on the students that how we can give more of placements and genuine placements. So without any delay, let me take what are the different aspects we have and what are the different factors to decide whether the Clinosol we can go ahead or how we can look into the activities. Okay, so now first one, let me check the first one, which is your syllabus. So the first activity which I'll be showing you is what is the syllabus for the different topics or different subjects which we are taking. So this is about clinical research. The clinical research syllabus is very much drastically discussed, which includes your history of clinical trials, discovery, phases of trials, and GCPs and glossaries, and investigators, drug accountabilities, ICF, sponsor responsibilities, CRAs, decentralized trial, NDCTs, and EPROs, and all those topics will be covered in CDM. or CR. So CDM, you will have a protocol review, time and events, CRF creations, and then edit check specifications, manual listings, vendor reconciliations, and then freezing, unfreezing, post-production changes. And pharmacovigilance, there is a collections, reporting of ICSR, sources of cases, MCCs, and case processing workflows, medical coding, narrative writing, causality assessment, reporting, aggregate reporting, and COPs. Like that, similarly, the medical writing includes your investigator responsibilities, IRBs, copyrights, plagiarisms, content research writing, protocol development, ICF development, CRF development, so on. So this is about the SAS. This is about the regulatory efforts. This is about TMF. This is about communication skills. What are the syllabus we are going to take it in communication skills and Excel and Power BI. So communication skills, Excel and Power BI are complementary courses. This will be added as free of cost for the students so that they can learn. So this is the difference. The first factor which you have to decide is based on the syllabus. So the syllabus is been keep on changing every 3 months. Once we keep on changing, and we take suggestions and also decisions from our advisors and also our mentors who guide us for developing this syllabus time to time. So now coming back to LMS, which is I think most of you guys wanted to see how LMS looks at it. We are associated with Tribite, who provides the LMS access. So this is LMS access learning at clinosol.com. So you have all this kind of courses which will be available. Once you get access, you will have all the access like this. You can go ahead. And then you will have classes. So for example, CDM class, if you want to go, so you can go ahead and understand that how CDM does this work. So, say for example, I'm just taking random topic of edit check specification. Once you play a video, so it plays a video. So we have something around 200 plus videos which will be given access to the students. So in the similar way, LMS will be used for the student at any point in time. You can learn and you can grow your knowledge for LMS kind of activities. So this is learning management system wherein students can access the videos at any point before they come to class. They will complete the topic. They will make a note of the topics, and then they will come up and ask questions more to the trainers. And this is about expert trainers, experienced trainers. We only take more than 15 years of trainers experience. We have Lavanya, we have Almas, we have Uma, and we have me as a trainers, and we train on different aspects. And one of the most interesting factor which we will always put pressure is we are permanent trainers. We don't have a part-time trainers. You can't come and say that, sir, you give training and then you go for a work. So we don't work for any other companies. We work only for Clinosol. So either Uma or Almas or Lavanya or me, we work as a permanent trainers, and we bring up that kind of an environment where we 24/7, we think about how we can ensure that the Clinosol students are learning as per practical standards. Now coming back to learning materials. So this is one more interesting factor. So the learning materials will be given to students, including CR, PV, or the SAS materials, or the MS Excel materials. All materials will be given. So this is about your CR material. So CR material book, and you have the similar way, you have CDM materials. So CDM materials and books, databases, and all the data validation specification, everything will be given for our students. So this is about learning material. Most interesting, everyone wants to listen about one thing which is called as placements. So show me what is that which you can give that other organization cannot give. So that's something which is called as placements. So our students, irrespective of different companies, we don't have one company to name it. We have different companies, including the startups, mid-level and MNCs, and different locations, including Hyderabad, Bangalore, Mumbai, and also Pune and Delhi. Our students are getting placed. So this is 2024 data. So this is January month placements, and this is your February month placements, and this is March month placement, April month placement, May month placement, June month, and July month. So today we have released the July month placements. So these are the students who have got job. Around, I think, 10 placements we have got in the month of July. And we give what are the companies, the registration IDs, the qualifications, and passed out year of the student, and also the company they have joined, and also the position they have joined. So this is how we give the placement students, wherein they will be able to do it. And this is 2023 data. So this is January, February, March, April, May, June, July, August, and December. So till last year, we had something around 140 placements. This is about 2022. These are the placements. I think around 150, 178 placements we have got, and this is about 2019 to 2021. So we are the only organization, on an average, we are giving around 10 to 15 jobs every month. So that's the factors which are being deciding why Clinosol people wanted to get job. So we are just not a training organization. We also support our students for the highest placement record. Now coming back to IES, what best we can give for industry expert sessions. So every weekend we have an industry expert sessions, and these are the details of the industry experts. There are people who are founders and CEOs. There are people who are the chief operations and then co-founders, and then the consultants and CEOs. All these people takes the session for us, and around 26 sessions. 26 sessions for industry expert this year we have conducted, and this is the last year data we have conducted. I think nearly we have conducted more than 66 as of now on paper. We have conducted the industry expert session. So this is about most interesting and most important factor that we are providing that other organization is not able to touch us is industry expert sessions. And one more thing, back to back, Indian Medical Association, Indian Pharmaceutical Association, and also National Integrated Medical Association gave 9 awards back to back. Out of 9 awards, 1 award was international award, which I got last year in Malaysia. So Outstanding Excellence Award by Prisal Malaysia we have got. And these were back-to-back 9 awards for the highest training and highest placement record for the Clinosol. And I'm very proud to say that we are the organization which gives the numbers and data for either it is trainings or placements or recruitment or whatever it is. So now coming back to most interesting question, everyone has this question that what courses we can take, how we can take. So now I'll just take 1 minute of your time to explain about all these courses. You have individual courses, you can take it up. Like CR, you can take PV, you can take CDM, you can take regulatory affairs, you can take medical writing, you can take medical coding, you can take. So all these courses, individual courses, we only give online, which is LMS. We only give, which is a certificate course, and we have given the eligibility criteria also. For individual course, we don't want students to take individual course, but if you are still thinking to take individual course, you can take, but we only give an LMS access. The reason why we don't allow or why we don't encourage individual courses is might be that course might come up with openings or might not come up with openings. So we want our students to take more course combinations so that they will have multiple opportunities to get a job. So there are advanced PG diploma courses, including CR, PV, CDM, medical writing, regulatory affairs, and medical coding and SAS. So these are the course combinations, and nearly 3 to 4 months of duration will be there. And this courses, you can do it online and you can do it offline also. Offline classes will be in Hyderabad, and every month one batch will be taken. And this month we are starting now the new batch, which is starting from tomorrow or day after tomorrow. So individual courses, 1 month only online, but course combinations you can take online and offline. So offline it at Hyderabad office. So I'll be the trainer for offline, but online. So there are multiple trainers who will be taking these courses. And now assessments, this is most interesting. We are more focused on assessment of students. So these are the GCP question paper. So say, for example, if I want to show you here. So this is the question paper, which we always say our students that you have to write more exams so that you get more preferred answers. So now we will give short note questions, and then all these questions has to be answered. We will give 1 hour of time to complete all these questions. So this is about the assessments of CR. This is assessments of CPV. This is assessment of CDM. And coming back to blogs, blogs is most interesting. Every student writes 1 blog, and we have published more than 700 blogs till. And we have the blogspot. Everyone can go and look into it. Clinosolresearchblogspot.com. And here the blogspot, we publish our student data, like say, for example, advanced data analytics with AI for clinical trials. So this was been submitted, I think, 1 week back. And you can read all this AI-powered database management, AI-enriched medical coding, future trends and challenges of clinical trials, and future challenges of application signal management or signal mining, collaborative initiatives. All these blogs are available online. You can read. Our students have written, and also you can read and say that, okay, who is the student who have written, because the students will be giving their details at the end. So this is about your blogspot. And coming back to one of the interesting things, the articles. Everyone wants to know that how many articles are being published. I think around 300 plus articles got published by our students. So this is the data. Every group publishes the articles wherein 2 people to 3 people form a group and they publish an article. So this is the group one. These 2 people have published in Jan 2023 International Journal of Scientific, and this is the topic, and they will be giving a hyperlink also that how journal is being published and where the journal is located. So like this, articles are being published by our students, and we want every student to publish the articles. It's not about just attending the tuition and going home and saying that, okay, we have completed our course, we have got our certificate, now where is the job? So now these are the articles, these are the things which our students are different from other organizations. So we say it on words or we show it on data so that you understand that how many we can publish. So these are the articles which are getting published by our students. So this is about articles. And coming back to presentations, our students have published more than 300 plus presentations. And this is 305 slides, and it is online available, slideshare.clinosol India. You can go through and you can understand that how many slides are being there, and you can look into what are the slides which are available. So you have all the slides which are being given. So 3 days back, 5 days back also, we have submitted a lot of slides. So you can click on slideshare.net Clinosol India presentation. So I think 2 days back we have given data reconciliation, and then machine learning, and then data standards and data driven site selections, streamlining of clinical research, machine learning, predictive analysis. So much advanced topic our students are doing it. And if you click on this, then you will understand who is the student who have written it and which is the batch particularly they have written it. So now say for example, if you see Konda Ramya, she is a student of online and she is from June batch submitted this presentation. So you can go ahead and you can see that what presentation they have taken and how this presentation help you guys. And then this comes up with webinars and workshops. So this is webinars and workshops where we have sent our students to attend the webinars and workshops back to back. So many webinars we are conducting and so many workshops we are conducting for the advanced topics for the students, where they can understand how students can improve their knowledge. So this is about the webinars, conferences, and also the workshops. So a big list of data is there, wherein we have conducted so many activities in this year. So these are the conferences, workshops, and also the activities which are being done in this particular year. And coming back to collaborations, we are collaborated with all organizations, including CROs, IT companies, including the colleges, MOUs, and everyone we are collaborated so that our students get more of internships, our students get more of the openings and also hands-on learning, CEO meetings and all those stuff our students wanted to get. So we are getting MOU signed. So 2024, we have signed 14. And 2023, I think we have signed more than 22 as of now on paper. So these are the MOUs which are being signed. And this is about social presence. We are the one organization which is having the highest followers in LinkedIn. We are nearly 40,000. And our social presence have 40,000 followers in LinkedIn. Facebook, we have 5,000. Instagram, we have 3,000. YouTube, we have 322 videos. And all videos are clinical research or CDM or pharmacovigilance and medical writing and medical coding videos. And we have 2.2 subscribers in YouTube also. And complementary courses, apart from the major courses like CR, CDM, PV, medical writing, medical coding, what are the complementary courses which are being given supportive to our students? So these are the courses. We give communication skills, MS Excel, and some of the course combination, communication skills, MS Excel, and Power BI are being given. Every student have to undergo at least 3 mock interviews, and their resumes will be reviewed by us. LinkedIn will be reviewed by us. We will be asking you to create your LinkedIn profile and be active on LinkedIn profile. So this is the course combination which you will have. 3+2 course combination like CR, CDM, PV, and communication and MS Excel. So this is combination number 1, 3+2, which is CR, CDM, PV, and communication skill and Excel. And combination 2 is 4+2, CR, CDM, PV, medical writing, communication skills, and MS Excel. Combination 3, 5+3, which is CR, CDM, PV, medical writing, regulatory affairs, and communication skills, and MS Excel. Combination 4, which is 6+4, which is CR, CDM, PV, medical writing, regulatory affairs, and clinical SAS. So these are the courses which we will have. And I'll be discussing about fee structure because everyone is waiting for the fee structure. After this, I'll be discussing about fee structures. And coming back to assignments, what are the assignments we give our students? We give our students to write, develop the protocols, ICFs, and also investigator brochures, essential documents, and all those stuff. So these are the topics which we cover to create the protocols and schedule creations and creation of ICFs, and creation of folders for GCP, essential documents. And for CDM, these are the things which we will take care for assignments. And PV, these are the assignment which we will take. So it means that you will have a hands-on training on system-based with hands-on projects and mini projects. So coming back to this is alumni meets, where we conduct the alumni meets every week, weekend one session. So the ecosystem of Clinosol is being prepared in such a way. Once a student of Clinosol will be always a student of Clinosol. So how this happens is, first Clinosol, we give a demo. After that, we have an exam tomorrow, and then we take the admission. And then you have a training, which is of 3 months to 4 months, but you will be given 1 year of access, 1 year of training, where you can attend 1 year, any number of classes, any number of batches. Then you will go for a placements. And then once you get a job also, you will undergo some reskilling, upskilling, CCDM certification, GVP certifications, or GCP certifications, or SAS certification. Then after you get first job, second job also, we will be giving placements. And also one more time, you can attend number of classes and number of times you can attend the classes. So the ecosystem is being prepared. Once a student joins in Clinosol, he goes into a group wherein he can learn everything, and then he gets a job, he goes into alumni group. Alumni group, he will learn with other people also. So we are very proud that we have 1,300 alumni network all over the world, and we have the offices in India and as well as in Canada. So this is about the ecosystem. And I know everyone is waiting for my last slide, which is your fees collections. So I know that I'm waiting for this to pop up. So this is about the fee structures. So I'm putting my fee structure. So after this, I'll hand it over to Uma. So now first course combination, the combo one, the CR CDM PV. So this is the combo one where most of student takes this CR CDM PV along with communication and Excel, along with the LMS access free of cost, materials free of cost, including blogs, articles, presentations, IES, alumni network, assignments, assessments, all those things, including placement assistance. It will cost around 15,000. So this is the cost which we have decided for this batch. But this 15,000 is only for spot registration, which is for tomorrow. So if you close your admission for tomorrow, it is 15,000, any three of course combination. And you will have both online and offline. You can take either LMS or online or offline. But if you wanted to take after tomorrow, then your course is 16,500. If you wanted to take 2 times payment also, it is 16,500. So only single time payment, tomorrow admission, after you write exam, it is 15,000. So this is the course combination. This is the first course combination you are being given, and it can be taken into LMS or offline. So now course combination 2, which is 4 course combination, including communication skills and MS Excel. Tomorrow, if you complete the admission, then it is 17,000. And if you wanted to take LMS or offline, it is 18,500. And if you are going for 5 course combination, then it is 20,000 fees. And then if you are going for the LMS and offline mode, then it will be a 21,500. And if you are going for 6 course combination, the course combination, 6 course combination, the fees is 25,000, and 6 courses, it is online, and 27,500. If you go beyond tomorrow, it is 25,500. So we'll be giving more details about the fee structures and all these details tomorrow. You will have more information. Fee structure for offline will be more. I'll repeat these words. Fee structure for offline, it will be more. For online, it will be only this fees till tomorrow. These are the fees for till tomorrow: 15,000, 17,000, 20,000, and 25,000. After tomorrow for online, so this is the fees. But for offline, we will get back to you, because offline we wanted to increase the fees so that students get more serious to come and join the offline classes. So efforts of offline classes will be more. But for online classes, this is the fees. This is the fees for online classes. We will be giving this as tomorrow fees. If you complete your admission process, we'll be sending a mail, LMS access, materials, and registration IDs and everything. So this is tomorrow fees. And if you wanted to take after tomorrow, this is the fee structure for online. For offline, we will get back to you for the fees by tomorrow. So it will be something around 5,000 or 6,000 difference between online and offline fees. So this is about the fee structure for course combination. Now, say for example, if you wanted to come for a separate single courses, like say for example, CR you want to take, PV you want to take, CDM you want to take, medical writing or regulatory affair, it will be a 12,000 single course and LMS only tomorrow admission. So if you take lateral entry day after tomorrow, then it is 13,500. Only online will be given, no offline, single courses will be avoided or provided. So this is the course, or this is the combination. I'll repeat it. 3 course combination, 15,000 for tomorrow. Day after tomorrow onwards, 16,500. Offline, we will let you know. Online, it is 15,000. Offline, we'll let you know. It will be 20,000 around something for 3 course combination. And 4 course combination, it is 17,000 for online. And also day after tomorrow, it is 18,500 onwards. And then 5 course combination, 20,000. And day after tomorrow, it will be 21,500. And 6 course combination, 25,000 for online. And after that, you will have 27,500. If you close your admission tomorrow, you will have this fee structures. And if any single course, it will be 12,000 for only LMS access. So now I think this is what is the fee structure. Duration is for 3 course combination. The fees duration will be 3 to 4 months. And 4 course combination, it will be around 4 months. 5 course combination, 5 months, and 6 course combination is 6 months. Both online and offline, 1 year validity, LMS access and materials. All 4 trainers will be there. Assignments, assessment, blog, article, presentations, 1 conference, and then you will have industry experts and alumni sessions for this. So altogether, this fee is being added. No hidden charges, no certification cost. You will be given certificate, letter of recommendation. You will be supported for the placement assistance, and also your resumes and LinkedIn. Everything will be taken care by us. I think with that short note, I'll hold it here and I'll hand it over to Uma for further session. Uma,
Thank you so much. Yes, I'm sharing. So we were talking about our training courses, how we have identified the gaps from the academics to the industry. All that stuff has been talked by my colleagues over here. And I would like to speak a little about our milestones and what we have done in all these 5 years. Is we have collaborated with so many organizations that may be from the industry, which is nothing but your contract research organizations, the core pharma companies, the biotech companies, or the pharma IT companies. And we have in academics, we have collaboration with pharmacy colleges, medical dental colleges, and all the prestigious universities. So we do programs with in collaboration with universities as well. And we have industry associations such as ACDM Association for Clinical Data Management. We are the only organization, why we have discussed all these things here is we are the only training organization that is collaborated with these many areas. Okay. We are also associated with Society for Clinical Data Management, and we have recently done an online webinar with the CDM, and we every year sponsor and we every year participate in ACDM India's annual conferences as a speaker as well as a sponsor. And we are also associated with Indian Society for Clinical Research, and every year we are doing conferences, workshops and webinars with ISCR as well. And we are really proud to say that Almas was mentioning, we have recently done MEDRA workshop, 2 days of workshop. MEDRA is the only one and only regulatory approved medical dictionary for clinical trials or clinical research, you can say. And we are the only organization collaborated with MEDRA, and we'll be doing, we are giving 6 weeks of training program to our students exclusively. And along with them, in our collaborated colleges, we are conducting 2 days of workshop along with MEDRA on medical coding or clinical coding, you can say. And we are collaborated with Eduquest, which is a Canada-based education consultancy. The director of Eduquest is also a very close associate, one of our core member of Clinosol, and you can get Canadian immigration consultancy services with them. And we also have Inference and Texium as our mentor companies, where they'll be guiding on data mining as well as the data analysis part. And we have collaboration with International Training Organization, which is MARS. which is based out of Lebanon and Middle East. And we have site management organizations, which are nothing but who conducts the clinical trials. We are collaborated with so many healthcare organizations that conduct the clinical trials. And academic associations, we are collaborated with Indian Pharmaceutical Association. So as Mujib was mentioning, we have a largest alumni network. It's an ecosystem. Our students will become our alumni. Again, they come back and they give guidance to our students. And again, they will learn with us. They go for the next placement as well. We have a huge industry network as we all are from the industry. We have lots of industry connections. We can you can also go and check our LinkedIn profiles where we are connected with most of the industry experts from the clinical research industry. And we have reached across India, almost all the states, and our students are there in US, Canada, Germany, the Middle East, Netherlands, and UK. These are our milestones. It's a very big picture, but I wanted to make it very short. Okay. We have started in 2019 March, and since that time we have started our placements simultaneously. It's not that we train and we send them out. From 2019, since its inception, we have started focusing on the placements, and we are happy that we have given 50 plus placements out of 75 students when we have taken the admissions in 2019. And it has started growing, and especially you can see the bigger number over here, which is in the time of at the time of COVID, we were getting lots of vaccine projects, so the number has increased to more than 350. I think it was around 400, and we have got an award for that also from Indian Pharmaceutical Association. These are the yearly kind of placements that I'm showing on my screen to you. And from 2020 onwards, we have focused on blog writings because of a special requirement that the industry was having on written communication skills and oral presentation skills of our candidates or the students. So we have specially focused on blogs. We have specially focused on article publications, which Mujib has already shown to you, and Mujib sir has already shown to you. And we have also focused on industry expert sessions. Earlier we used to do, but not with a special focus. But these days, from 2020 to 23 onwards, we are doing it regularly so that we can connect you with the industry experts. Generally, you don't see anywhere industry expert coming into college or getting connected with a student specifically out of their free time, right? Here all the industry experts from India, from abroad, they come and talk to the students, interact with the students. They give their expertise, and they give their industry insights. What are the latest advances that are coming into the industry? And we conduct free webinars with collaborated colleges, and workshops with our collaborated colleges as well on latest topics. We have conducted so many workshops. Specifically, we have focused on workshops in 2024, and we have reached to almost 24-25 workshops and 50 plus webinars so far in this year. So this month has proven to be a very good month for us. We have done lots of programs. I don't want to show this much, just a glimpse of our placements in this year, specifically in all these 7 months span. You can see the placements over here. And we have done a few publications. We can see every month we have done how many publications over here. I would like to quickly flip this. And you can see we are a part of Indian Pharmaceutical Congress every time. For the last 2 years, definitely, we are a part of that. And Mujib sir is the speaker. And we are also leading the placement conclave Indian Pharmaceutical Congress every year. This year also, we have helped the IPA to place more than 100 students on spot. Offer letters have been received by the pharmacy students on spot during this event, this 2-3 days of event. And so many workshop, conferences, webinars we have conducted this year, and you can see a glimpse of that over here, where Mujib sir was a speaker at IPC, and we were placing, and you can see kind of industry experts coming and interacting with our students on the latest trends and technologies, and all the expert interactions are happening, and we are participating in the workshops. The Medra workshop you can see over here. The 2 days of Medra workshop we have conducted in Bangalore, Alamein College of Pharmacy, in association with Medra. So this is the SCDM conference, webinar which we have done very recently. All the team from the big shots of this SCDM committee have specifically targeted the Indian market, and this time they have given a free kind of a certificate course for all the students in data management. So this is our upcoming event where we are participating in 11th Annual Pharmacovigilance Symposium, which is by the ISER. You can see the agenda over here. We are an academic sponsor, and we also have Mujib sir as a speaker over here, which is going to happen in D.Y. Patil University School of Medicine in Mumbai on the 10th of August. You can see our logo over here as an academic partner. Okay. So we have so many college workshops, coming up with the collaborated colleges and universities. And we are also planning a few CEO meets and industry visits for our students. And we are also planning a few master classes for the students. There is some technical glitch. I apologize for that. Okay. My cursor is not moving properly. Okay. I hope you can see my screen, and we are there in every social media: Facebook, Instagram, YouTube, Twitter, LinkedIn. Everywhere we are there. You can just go and visit our postings. You can check our profile. You can go to our website, see what kind of activities we are doing. You can get in touch with our team for your admission process. You can see our headquarter address as well as our Canada address. With this, I stop my presentation, and we are open to the questions. Team, can you just go to the chat box?
I'll make them unmute so they can ask me questions. They can ask us questions.
I could see a few questions over here. Students who are currently pursuing has a doubt whether they can start their course with us.
Yeah, so I can go ahead with the answers if everyone is.
Please. Yes, please.
Yeah, so I think final year students, you can get into this course. We are excited to have final year students with us. We wanted final year students to be with us because you have 1 year of time and you can go for internships also. So we'll be able to help you as much as possible. 1 year of time you can study, you can learn, you can write more blogs and articles and presentation. So 1 year you can spend time with Clinosol with the same fees after completing rather than waiting for the course to complete. I think we are excited if you can get into admission into Clinosol now itself, because we had PharmDs who were in 4th year who took admission after 6th year. Immediately they started applying for job and they got the jobs. So we have seen the student who have got the highest salaries of PharmDs with 9 lakhs or 10 lakhs also. And those people who have just completed their 4th year, they took admission and they came into Clinosol. So we are open. We wanted students to take admission in final year also, or 4th year.
So there is one more question about the duration, 5 months duration. What is the fee? It's not, don't look at the duration. Go with the combination, which combination you wanted to choose. Just go with that, discuss with our team. They will be guiding you on the fee structure.
Yeah, tomorrow morning there will be an exam, online exam will be there. And this online exam, once it is completed, you will be given more details about the fee structure. Written mail will come, and then you can complete your admission process. So the fees which has been discussed is the 15,000 and 17,000 and 21,000 or something like that, which we will be giving in WhatsApp group. What is the fee structure? And tomorrow morning there will be a written exam. After that, you have to complete your fees payment, and then you upload your screenshots and all those details. Then we'll send a mail about admission confirmation and all those details. And based on it, you will confirm your admissions.
Okay,
Perfect.
I'm failed to understand this question. So along with what we choose, we get extra domain. I didn't get this question, Dr. Ram. Please elaborate your question. You can unmute and speak.
Yeah, they'll be getting extra classes for this, extra complementary courses they'll be getting.
I couldn't be able to get his question properly. So we have already shown what are the combinational courses that we are giving, along with complementary options. Mujib sir has already
Most
shown
of
that.
the people, most of students are taking CR, CDM and PV courses. The combination where more jobs are been coming. So the CR, CDM and PV course is been something which everyone is liking to join, and everyone is liking to take it up. So CR, CDM, PV is the course combination where they are able to take more courses in combination of CR, CDM, PV. And Jamuna, I think MSc Biochemistry 2010, we will be able to give admission. We are not saying no to anyone. Earlier, we used to say no, but now we are giving admissions. But coming back to placements, it all depends on company, and it all depends on the candidature also. So placements assistance will be given for every student. But when you are comparing yourself to 2024 passed out, the companies have to choose you. So we will put your profile in front of company, definitely no doubt about it. But what basis you can confirm them, what basis you can convince the companies for getting the placement assistance is something which you have to understand and which you have to speak during interview.
Our friend has a question. She's from Bangalore looking for job opportunities in PV and medical coding, Medra.
Yeah, we can. For Bangalore, we have a lot of openings. So thank you, Afreen, for joining. For Bangalore, we have so many openings. And I think most of you guys might have met me either in one or the other way conferences or some of the events. Some people are from different known colleges. You can unmute and speak. You can give any feedbacks you wanted to give. You can
Priyanka has a question. Almas, you want to answer Priyanka's question?
Yeah, hi Priyanka. I think it would be great if you joined a combination with PV. So with 3 years of experience, the courses that we conduct or the session that we'll take up, it will have more. If you have done in your ICSR, we are also covering higher level of pharmacovigilance activities like aggregate signal detection, RMP. So definitely it would be a good choice to go ahead with PV along with your CR, MW and CDM.
Yeah.
Okay. Students, come on, we have given you the access to unmute. You can ask your questions, student. This is an opportunity. Please be open, transparent. Please do not hesitate. Any question that you have, please feel free to ask your questions. We are here to help you make a choice decision on pursuing what is your aspiration, what do you want to pick up, anything that you want to ask about, what are the career opportunities. Please feel free to ask us. We'll be happy to answer your queries.
Hello, ma'am.
Yes.
I'm Ashrin Unesa. Actually, I want to ask if we pursue only one course, so how it will goes like about placements and I want to know about more about the classes like we have to attend by ourselves. Like after attending the classes, we have to go through the once we have completed the watching videos or the classes, then next step we have to go to the examinations. Like I'm asking the whole procedure that what we have to do while after taking the admissions.
Okay. So after you take up your admission and you complete your payment, we give you the access to the LMS. once you have an access to LMS, you can access all the videos depending upon the combination that you have taken in, right? So initial access would be provided to CR because for all other domains, clinical research is the basic, because we cover, ICH and GCP, basics of clinical trials, other regulations, right? So it's important for you to start with that sequence, okay? So we give you that access, you go through the LMS videos, and then we have regular classes. So in a week, we have 2-3 classes. These classes are scheduled in the evening, so the students who are attending their regular lectures, their college lectures, that is not interrupted, right? So our classes start from 6, 7, 8. We will be sharing the schedule in the groups that you get added to, right? And there would be revision session also. So if you have opted for online, these are the classes where trainers, each one of us, Mujib, Uma, Lavanya, myself, we take up these sessions. So we have Shakti also, who is another trainer who is taking care of clinical research classes, okay? So all these trainers would be taking up classes in a week. LMS access is for you. You can, if you have some free time, there is no restriction. You can take up some sessions even before we start taking the classes. And you can come up with your doubts, queries during the sessions that we take up. I hope I have answered your question.
Yes, you answered, but I want to know that if I have learned all the videos or whatever the content in that, then I have to write the exam like that I'm asking.
See, the whole process works in this way, that first, once you have gone through the classes, then there will be a live classes. Videos are being completed, then you will have a live classes. That's a step number 1. And then we will be having more interview-based questions during live session. That's a step number 2. And step number 3 is every week there will be a revision class of that complete week, 5 days classes. That's a step number 3. And step number 4 is assessments and assignment. And step number 5 is blogs, articles, and presentations.
चिंदी लोक काम करतायत माहिती का.
Step number 7 is your blogs, articles, and presentations. Step number 8 is, which is parallel step, which is IES and conferences and workshop. So this is the overall flow of the events which will happen. First, online videos, then online or offline classes, then revision classes, then assessments, assignments, then workshops, conferences, and then industry experts and alumni sessions. Finally, one final assessment and certification. Single course, if you take it, but whenever there is an opening of that single course, we will be sending your resume. Will not be sending you for other profile. Course combination, biggest advantage, you can apply for any kind of 3 jobs. There will be a dedicated groups where students gets to know about the openings. There is a dedicated team who does it. We will not suggest you for single course, but it all depends on you to take a single course. I hope I have answered now more clearly for you.
Yes, yes. Thank you. Thank you very much.
Okay, so regarding placement assistant, I think some students had a query. So see, the courses that we are conducting and the opportunities that we give you, there's a group in which you get added, and all opportunities are shared. Even during the sessions we share, and we are taking up mock interviews. So we prep you depending upon the role specific requirement. So it is not restricted to any location as such, whether whether you want to pick up Hyderabad, Mumbai, Pune, Bangalore, you have a flexibility. Before we share your resume to the corporate, we ensure that we take your, we understand what is your preference on the location. Only then we share your resume. Okay, so opportunities are in all cities, wherever we, we have partner. All the requirement that come to us, we will be sharing this requirement with all our students.
Yeah, I think there is one more question. I'm working as CRC. Is it necessary to have GCP certificate for placements? Is there any validity? See, there is no rule and regulations either in GCP or in 21 CFRs that GCP certificate should have validity of this much years. But from years together, we have said that 2 years is the validity. But that 2 years is not mentioned in any regulation or guidelines. So it becomes more complicated to discuss this kind of questions. But separately, if you ask me, GCP certificate has a validity of 2 years, but there is no written regulation that 2 years is validity. So, and our certificate is being verified and validated by international standards. So this is what is the answer which I wanted to give. Any other questions, Uma? Would you like me to take?
Yeah, there is a question which says, is there any major difference in online and offline mode?
major difference will not be there because all the sessions, LMS sessions will be taken same, but we wanted to increase the fees of offline because the offline students were turning up to online. So we wanted to increase the fees of offline so that they become more serious to pay more money. So there is no difference between online and offline. Only thing is online more trainers are there. Offline I'll be the trainer. And Uma sometimes takes the sessions. And offline only at Hyderabad this time. Can we do work from home? Answer is 90% no, 10% yes. So I hope I have answered that question very sharply. 10% is yes, 90% is no. Freshers don't expect work from home. Get 4-5 years experience, go office, sit there, learn the rules and regulations and corporate cultures, then you will be given work from home. That's where you understand what is the situation of work from home. It's not that work from home, attend the meeting, switch off the video, switch on mute camera, and then sit directly. There are only few companies which are giving permanent work from home. Few companies, name it as Cineos, they are giving permanent work from home. Teva, they are giving permanent work from home. But no other companies are giving permanent work from home, only partial. So 3 days a week, 2 days a week, something like that. IQVIA, PPD, they are giving only partial work from home. So I hope I have answered that question. No 100% work from home. Make your mind that work from home will not be an option in clinical research. We are in regulated environment. What is the timing for offline classes? Morning 10 o'clock to 12 o'clock. Any other questions, Lavanya, I have to take?
I think we can just reiterate the course combination one more time. That
Yeah,
is,
I think one student wanted to ask if she is just interested in taking up medical writing and regulatory affair, if she can pick up these two courses.
We can get back to this question later on, Mas, because
Yeah.
we talk about internally if
Correct,
this
correct.
combination works or not. We 4 people can discuss later on. Yeah, someone wants to share the course combination by any chance? Anyone wants to share the course combination by any chance? Anyone?
I'm unable to share my screen. Almaz, if you could, or Uma could.
Yeah, wait, I'll make you co-host now. Now, check.
Just once.
So any feedbacks anyone have, please give feedback. How was the session? You are able to answer all those questions. You got the answers for everything. Is there something which we missed it?
No, Bujib, I do not have that access, that link. So maybe you could try it.
Yeah.
Yeah, offline classes, presently we are taking it only at Hyderabad. It will be in the evening, like we have mentioned earlier, right? So for now, offline classes is only at Hyderabad.
Yeah, morning 10 a.m. to 12 p.m.
Okay. Okay, give me 1 minute.
Anybody have any questions with regard to career progression, or do you want to know what are the roles? Then please feel free
Please.
to ask us.
Feel free to ask and we'll be able to answer all kind of questions. So I'll just show it, the fee structures and course combinations which are being taken. So very quickly in a minute, I'll show it so that you set it into everything.
Okay,
What
Jansi here has a question. She says, I'm already working in an API pharma industry as QA executive. I have time constraints regarding online. Is there an exclusive weekend batch?
As of now, no, but we can look into that option also. You get connected to us later on. We can have, because we are giving LMS access, so we can batch also. We can think about it. So this is the course combination, CR, CDM and PV, communication skill, MS Excel, 15,000 for online tomorrow. And day after tomorrow onwards, it will be 16,500. For offline, it will be 20,000. 4 course combinations, CR, CDM, PV, medical writing. Tomorrow it is 17,000. For day after tomorrow onwards, it is 18,500. And then for offline, it is 20,000. For 5 course combination, tomorrow, if you're using it is 20,000. For tomorrow, day after tomorrow, it is 21,000. And for offline, it is 27,500. For 6 course combination, it is 25,000. And day after tomorrow, it is 27,500. And then offline classes, it is 30,000. So this is the course combination which you have. For individual courses, any course 12,000 for online LMS access. So these are the course combination which are being given.
So a lot of students are asking about what is this test that we will be conducting tomorrow?
Online test will be there. Online test will be there.
What kind of questions can they expect?
Communication skills and aptitude questions, no worries. We just wanted to understand your capabilities to see that whether at least you are able to speak, write, understand the stories and give answers. Very easy. It's only 30 minutes of questions which will be given. And you will be asked to create a video, self video. There will be a question, tell me about yourself. You have to record your self video, upload it. So we will review that video before we confirm your admissions. That's it.
So the test is basically to understand you all better. It is also a little bit of self-driven learning. We want you to have access to LMS, to navigate through LMS and understand all the concepts. So it's a very simple test, basically just for aptitude and your communication skills.
Yeah, installment details, 2 installment will be given, but the fees tomorrow, 1 fees. But if you are taking 2 installment, it will be having some 1,500 or 2,000 more fees will be there. What is the use of exam? We are very having usefulness of that exam because we want to know what is your capabilities before we give admission. So earlier it was very strict exam, but now we have a little bit given some freeness for that particular exam. What is the best growth future? All things are wonderful growth. Clinical research itself is the best growth. I think everyone is.
Our team share the online link for the exam. It should open at around 10 a.m. and you will be given the entire day till about 4 to finish it and upload it.
Yeah, and one more thing, guys, before I leave you, it's about the 3 days of classes and 1 day of exam and 1 day sometimes we will speak about resume writing. Offline classes also Monday, Tuesday, Wednesday is the classes. Thursday is the exam. Friday is the mock interviews. We take in this way. 5 days we have sessions. It's not that only 3 days weekly you have sessions. It's 5 days you have sessions. Online exam will be at around morning 10 o'clock. Everything will have the best future. Career gap depends. Sometimes it's yes, sometimes it's no.
Yeah, Jamuna, if you're like able to show the interviewers that the gap hasn't affected you, you have kept in touch with the industry, you're able to grasp all concepts and present yourself, there is no reason why a career gap should be a problem. It's totally in your hands how you present yourself and how is your learning directed.
Both are best, guys. Come on, nothing is worst. CR is best, PV is best. Almas comes from
Yeah,
PV.
yeah. I think Somdatta
Lavanya
is
comes from
repetitively
CR.
asking the same question. So Somdatta, see,
I'm
all
from
4
different.
trainers that you have seen today, Mujib, Uma, Lavanya, myself, we all come from different domain. Okay, so Lavanya with us, she's into CR. She has been mostly into clinical monitoring. Okay, Uma and Mujib, they have been into CDM. I am a PV expert since last 20 years, right? So we are all, each one of us, we are an expertise in our domain, right? So it's very difficult to say. It all depends upon your interest. Okay, what is your inclination and what is your career aspiration? Yeah.
My suggestion to you will be that you take the 3-course combination, and as you go through the course, you will understand your own inclination, your own preferences. So when you finish the course with us, you will yourself know which one are you more inclined to. So that will give you a direction. rather than
Absolutely.
telling us which is the best. I think it is what you would like to
Yeah.
choose for
And
your-
during your course, apart from these PV, CDM, PV, medical writing, all these sessions that we conduct, like we have mentioned earlier in the demo, we are taking your interview guidance session, right? We ask, we prep you on what is, how to pick up your role, right? So during this session, you will have good chance, after you complete some session, you listen from different industry expert, you start understanding the concept, what are the roles, what exactly you're expected to do in different domains. I'm sure you will be in a better position to pick up that, right? So that decision making will happen, and we are always there to guide you, mentor you. Okay.
I have a question. Can I ask?
Yes, Neha, please.
Are there any SaaS tools which we get trained in CDM?
Yeah, so basically we had an agreement with one of the company, which is Clinion. So we used to provide the training hands-on on Clinion system, and we have the recorded videos of Clinion. So ultimately, end of the day, no one is interested to learn on databases or applications or tools or assignment or assessments. Everyone wants one answer, that is jobs. So if you are being asked this question, do you want to learn on application or tool? You wanted to stay here for 6 months, or you want to get a job in 2 months? So what might be your answer? So might be, I don't know. So most of 90% of people are not interested in all those answers. So we used to have an agreement with Clinion, and now also we have an agreement with Clinion. So if anyone is interested to have hands-on on databases, we are open for it. We'll be able to provide you access.
Okay, thank you.
At end of the day, everyone wants only one word. What is that one word? Is the job.
Job. Yeah.
Not the applications or tool. Tomorrow, today you have Rave, tomorrow you have Inform, day after tomorrow you might have SAS, after that Python or R programming or XYZ might be coming, or Power BI might come. But the process will never change. Understand, you have foundation should be on process, not on the tools and application and database. Databases will come and go, AI will come and go, but process will never change. Protocol will stand as protocol only, ICF will stand as ICF only, data visualization stand as data visualization. You guys should not have myth that if you understand this, you'll get job. You just understand that the process is very short, the regulations are very short, guidelines very, very short. Any database you can learn in 1 or 2 days. It's not needed to learn from now itself. But we'll be able to give you access. I hope I have answered your question, Neha.
Yeah, thank you. Thank you so much.
Thank you.
Okay. Any other questions, students? Do you have any other questions?
If I want to do class weekly once, can I do it?
See, we are open to do whatever classes you want to do, but we will have our systems to assess you yourself. We want you to complete your blogs, articles, and presentation. And it's you who is going for interview. It's not us who is going for interviews. We just maintain our discipline, our standards. That's it. So you can attend one class, or you can come and say that, sir, we have attended one class. But ultimately, you want job. How many classes you attend, that much probability of getting job is more important. You might have spent this today with going for a movie also. But the probability of learning more here, 1.5 hours spending, is the one words which you have not heard, the one people you might have not have heard from different places, you might have met now or today. So that's 1.5 hour is very useful for you. Attend 1 hour or 10 hours, but ultimately you need a job. So for 3 course combination, I think around 90-100 videos will be there.
Every topic that we have given you a recorded lesson of it.
Yes.
And we haven't combined any topics. Each topic has been dealt with in great detail. So it's easily a 30 to 45-minute video. I mean, if you just watch the video, you can completely understand the topic from the scratch till a very, very advanced level. So it's not something that you can just watch in 10-15 minutes. These are serious learning modules.
Lavanya, Almas, Uma, can
Yeah, I think we can close the session. So students, I hope you have, got a good insight about all your queries on career. We are available. In the group, we will share our contact details. You can reach out to our team on any further queries that you have. Okay, so I hope you have enjoyed this session, and, we look forward to have you in our upcoming batches. Okay, so please grab the spot registration that Mujib has spoken about, right? And if there is any other queries, anything that you need, we will be available. You can, chat with our group, and whatever support you need, we are here. Wishing you all the best, student, and looking forward for all of you to becoming a Clinosol student, right? So happy learning. Thank you, all of you. Have a great evening ahead.
I just have one thing to say. If any of you want to connect individually, please leave a message with our team on the number
Yes.
they shared. If your query wasn't answered, or if you want to have more clarification, we can set up a one-on-one call. Reach out to our team and we will take it forward from there.
Absolutely. So students, though I think that all of you have spoken, this was an open session. Still, if there is any student who feels that, they are introvert, or there was any hesitation for any one of you to come up openly and, talk, either speak or put your queries in the chat, we are also okay to handle or answer your queries one-on-one. So you can reach out to our team, let us know with whom you would like to speak from all the speaker that you have seen interacted with today. We will be happy to connect